medical department is involved in all MSF's areas of intervention. Its role is to determine how the association's work should be organized in the field.
The department helps people going on their first mission to know what drugs and treatment protocols they'll be able to use.
Some 40 people work for the department.
The medical department has what we call medical advisors specialized in a particular field of medicine, like surgeons, anaesthetists or pediatricians. Or they may advise on diseases like tuberculosis and meningitis, or immunization.
Their work consists in drawing up treatment protocols and lists of drugs to standardize practices across the teams.
So how a particular disease is treated, with which drugs.
The advisors are also responsible for deciding what should be in each medical kit.
The kits are one of the most important things. They are what we need to treat 80 to 90% of problems straight away in the field during an emergency, and they must be immediately available.
An example is vaccination. The role of the medical department is to develop vaccination strategies, which involve identifying vaccines that are both efficient and cost-effective, and planning the cold chain.
And then we need to know who we're going to vaccinate. In a meningitis epidemic, the whole population, including adults, is affected. So we need to establish up until what age people will be vaccinated. Measles is different, as children are mostly affected. But sometimes we need to look at the number of registered cases and then decide if we're going to vaccinate up to 5 or 15 years old.
These strategies are particularly important now that we are seeing a resurgence in some epidemics, notably measles and polio.
Everything that MSF develops comes from our field experience. When we come across a particular situation, we try to find the solution. The medical department has evolved in much the same way.
The first guides, the clinical guidelines and the essential drugs guidelines, were written at the end of the 1970s, while MSF was working in refugee camps in Thailand.
And then one of the medical department's first big moments was the famine in the Sahel and Ethiopia in 1984-1985, when we realized that doctors and drugs were not enough. Malnourished people needed looking after and sanitation. Hygiene and vaccination were important too.
In 2000, Médecins Sans Frontières decided to introduce treatment for people living with HIV/AIDS. At the same time, the teams observed an increase in cases of drug-resistant tuberculosis, two issues that led to the arrival of new specialists tasked with drawing up new protocols and new medical kits. The most recent development is traumatology.
We started treating fractures. At first, not quite like it's done in Europe, but now we are. We use what we call osteosynthesis, so patients only spend days in hospitals rather than months.
A sign of our current focus, the medical department has several pharmacists monitoring the quality of our medical equipment and drug supplies at a time where there are more and more counterfeit products.
The role of the medical department is to support the field so that patients receive the same treatment, whether they be in Africa, Asia, Latin America or here. We don't want second-rate medicine. So our task is to find what's available in the scientific literature in Europe and adapt it to the field so that we deliver the best possible treatment to our patients in their environment.
Providing better care while getting closer to our patients is one of our objectives. The department is working on rapid diagnosis tests to be performed at the patient's bedside.
What we're looking at now is monitoring the chronically ill, particularly people with HIV/AIDS who are on ARV therapy. We want to be as close to them as possible to make sure that their treatment is always adapted.
Proximity to our patients is also the way for MSF to treat more people, and it's by calling on the very latest scientific developments that the association can succeed.